The broadcast is now starting. All attendees are in listen-only mode.
Thank you for joining us today. We are waiting a couple moments for more participants to join. We should begin shortly. Thank you for joining us today, and welcome to the Electronic Health Record Incentive Payment Attestation webinar. My name is Lori Landman, and I'm with North Carolina Medicaid. Also with us today is Jim Flowers from North Carolina Medicaid, and Bob Marcotte from the Office of Medicaid Management Systems, NC-MIPS, or North Carolina Medicaid Payment Incentive System. We are going to talk today about the Electronic Health Record Incentive. The program was initiated by the Centers of Medicare and Medicaid Services, CMS, through the provisions of the American Recovery and Reinvestment Act of 2009. Incentive payments to eligible professionals and eligible hospitals, including critical access hospitals, participating in Medicare and/or Medicaid programs that are meaningful users of certified electronic health records technology. The incentive payments are not a reimbursement, rather are intended to encourage eligible professionals and eligible hospitals to adopt, implement, and upgrade certified EHR technology and to use it in a meaningful manner. CMS has implemented the national program for these incentive payments, and the goals for the program include enhancement of care coordination and patient safety, reduction of paperwork and improved efficiencies, facilitation of electronic information sharing across providers, payers, and state lines, enablement of data sharing using State Health Information Exchange and the National Health Information Network. We're going to begin our presentation today with Bob Marcotte.
Thank you, Lori. So, Lori described the program. NC-MIPS, as we refer to it, is a technology solution which facilitates the registration and attestation process for eligible professionals and eligible hospitals and provides the state with validation features. Some upfront notes. We'll have links and contact information provided at the end of the presentation. We're going to address questions at the end, and we'll move quickly through the presentation to allow time for the questions. Feel free to type questions in as we move along, and we'll just begin to address those at the end. We can jump around as necessary, back and forth to specific points. With that, I'd like to begin getting into what NC-MIPS is. It's a complex system where this diagram shows the interactions between the providers who register with CMS and go through a registration process with NC-MIPS into attestation. We validate the attestation and issue the payments. Today, however, we're just going to focus on the three parts: the NC-MIPS registration, the capture of information regarding the participation requirements, and adopt, implement, or upgrade. The registration, as many of you are aware, the first step is to register with CMS. After a successful registration, North Carolina is notified, and we match the CMS registration record to the hospital record, and then we send out an email. If we encounter any trouble in matching, which seldom occurs with the hospitals, then we will perform outreach to work through to reconcile. The second step would be to obtain a North Carolina ID, an NC ID, which is used as an account for logging into NC-MIPS, and I'll show you a screenshot of that shortly. The final steps are to set up the account, where you take your CMS provided registration number, the NPN you use to register, the EIN associated with the registration, and your North Carolina MPN, and enter those, enter your NCID and password, and that NCID account will be linked to your registration. I mentioned NCID a couple times. NCID is a standard identity management and access service provided by the state to users of state services. It provides a high degree of security and access control to resources. NC MIPS uses it as our login controls to the provider portal. As mentioned previously on the last slide, the NCID is linked to a specific account, and then with the NCID linked to the account, you can proceed with the attestation. The link to the NCID website is found on the NC MIPS portal login page. It's also in the attestation user's guide that we have for hospitals. Once registered, go into the attestation process. The first step is to gather the necessary information. And one of the things we'll cover this morning is what information is required for completing an attestation. Essentially, that falls into two categories: patient volume information and patient calculation data. Once you have the information, you complete the online data entry, you submit the attestation online, and you create a printed copy of the attestation. The final step is to have an officer of the corporation sign and return the printed attestation with any supporting material. CMS has set a patient volume threshold for participation in the program. Hospitals must meet a 10% Medicaid patient volume threshold over a 90-day period in the prior fiscal year. North Carolina, in order to verify that and to support the attestation of meeting that threshold, requests that each hospital provide the total Medicaid acute care inpatient discharge number, total number of Medicaid emergency department visits, the total acute care inpatient discharges, and the total emergency department visits. Next is the patient calculation data page. Most of the information used in patient payment calculation comes from the hospital's most recent 12-month cost report. What we ask for is the fiscal year end for the hospital, the month of the hospital's fiscal year end. We ask for baseline information from the most recent 12-month cost report, as we described, and then to show how that information is used in coming up with the payment calculation, and to give you an idea of the specific information that we're looking for, I'm going to turn the presentation over to Jim Flowers to walk through the payment calculation worksheet.
The next several screens are divided up into several parts which will summarize the final calculations for a particular hospital. This will be the end results that you will see. Following these, we'll actually walk through the data input that's going to be required of the hospitals. This is set up in a CMS recommended format presented to the providers of how the calculation is to occur. This first step is to calculate the average annual growth rate for the last 3 years of data available. You have your base year of total discharges with the next 3 consecutive prior 12-month cost reporting periods. These are data input fields to calculate the average annual growth rate. Okay. Step 2 is calculating the amount that is associated with the average discharges for each cost report year. There's a $200 per discharge amount related to discharges between 1,149 and 23,000. For this particular hospital, the calculations are shown in years 1 through 4 to arrive at a total discharge related amount for this hospital. Step 3 is adding the base year amount of $2 million as outlined in the rule, plus each year's discharge related amount to come up with the aggregate electronic health record payment amount. Step 4, the rule applies a transition factor over 4 years. It steps down in increments of 25% from year 1 to year 4. Step 5 shows the calculation of the overall electronic health record payment amount for all 4 years. Step 6 is where the hospital input data on the attestation screens coming up will calculate the Medicaid share of that overall electronic health record payment. You have total Medicaid inpatient days, total Medicaid managed care inpatient days, total hospital total hospital charges. This is from worksheet C. The data source is listed there to the right. Total charity care and uncompensated care charges. This is an attestation amount using the online attestation. Since the 2552-96 does not have this data field valid for this entry, beginning with the 2552-10, this will come directly from the cost report. And then total hospital inpatient days is another input field. These are used to calculate the Medicaid share. Step 6 is applying the Medicaid share to the overall aggregate electronic health record payment amount to identify the Medicaid portion of what the hospital will receive. The rule then stipulates that the aggregate EHR incentive amount will be split over 3 years. The first year is a 50% payment, year 2 is a 40% payment, and the final year is a 10% payment, which will agree to the total payment eligible for that hospital.
Great, thanks, Jim. At this point, we will actually go in and take a look at the attestation process and registration process. This is the landing page for NC MIPS. There are 2 links at the bottom of the page. The first time in, you're going to be establishing your account, entering the 4 fields and linking it to an NC ID. So you would use the account setup. Once you have the account set up, you would go in and use the account login link subsequently. So we'll go through and do a setup. And I apologize, there will be a little bit of typing here, but the idea is to show those of you who haven't seen the application what it looks like, and hopefully to make life easier. So on the screen I entered the registration number as provided from CMS when registered with them, the NPI, TIN, or EIN, and the North Carolina MPN. Now I'm entering an NCID account that I had previously set up. If you look on this page, you'll see links that will take you to the NCID website. On the right-hand side is the home page for the website. The bullets on the left will help you if you need a new user ID or have forgotten a password. Once you've registered, you've completed these 2 screens, you'll need to use that same user ID and password for any maintenance that may come up. Okay, so once you've successfully logged in, and as you saw, you need to enter your right username and password combination. You are taken to a status screen. The status screen has some very basic information that came from your CMS registration, and in this case it shows that I am ready to proceed with year one. So I'm going to click the proceed button, and it's going to ask me to fill in contact information. And this is just so that we know how to reach you if there are any questions in the attestation process or attestation validation process. If you look on the left-hand side of the page, you'll see the screens that we're going to be walking through. And at the top left is the log out button. And the status page can be reached at any time by clicking the status page link or the attestation link at the top left. Next, we're going to be entering information related to the 10% threshold over 90 days. So we pick a start date. I'm going to pick first day of the fiscal year, and then we need to enter the 4 fields that I described earlier. It shows you the percentage, and once you've entered the information, just click next. We're quickly going through the information. We're quickly going through the entry. The next 2 screens are the most complex. They are where you enter the information related to the cost report and some attested information.
As Bob is entering the information, I wanted to insert a comment here regarding this screen. The screen was designed specifically around the hospital cost report at the inception of the rule. It is designed so that upon entering the information, it will tie exactly back to the cost report and summarize to the totals on the cost report. We recognize that not all of the information input on this screen will ultimately be used in the calculation of the electronic health record payment. In future releases of this, we will take steps to remove any information which is not necessary for the input of the calculation of the electronic health record. However, for purposes of getting this up and running, these are the fields that we require to complete.
Thanks, Jim. So as you can see, I'm just quickly going through the fields. Usual tabs and mousing works. So the last screen was for the 12-month baseline, as well as a few additional fields at the end. This screen is to capture the total discharges as opposed to the total Medicaid discharges. The total discharges, so the average annual growth rate can be computed. As you can see, there are a lot of fields, but if you have the information in front of you, you can go through these pages relatively quickly. The links at the bottom of the page, you have the previous and next to go between the pages. You also can reset the page, which would clear it. You can save and return later, which will take you out to the status screen, and then you can come back in and pick up where you left off. Or you can cancel this attestation, which will essentially clear the entire attestation. Once you've submitted the attestation electronically, you have the option of withdrawing it and resubmitting it. Having entered the cost report information necessary for the payment calculation, you're then asked the question regarding whether or not you have adopted, implemented, or upgraded. Here you can actually specify more than one of these items. And if you entered an EHR certification number with CMS, that will be defaulted in. Otherwise, you'll be asked to enter the EHR certification number here. Click Next, and at this point we have essentially completed the data entry process. No more numbers to enter, so give you a congratulations message and point out that on the next page you're going to be asked to attest to this information. So we have language from both CMS and North Carolina asking you to attest, and when you click the Submit button, the information is stored electronically. At this point, we're ready to print the attestation and get that signed and sent in. The instructions for that are here. The print button will bring up the attestation information. Let's see. And it gets opened in a PDF form. And as you can see, it is the information that was entered. At the end is a signature block. Sign it and then send it in. If you have any questions, you can always come into the status page. I'm going to complete this. It'll take me back to the status page. You can go through, see what you've done. If you need to reprint it, you can print it. And the question mark at the top will open up the EH attestation guide. So that's essentially the system. Once you have submitted electronically, printed, and signed it in, then we begin work on processing it. In processing it, we perform multiple checks. If there are any issues that come up, we will, and as you can see from the data entry, there are room for different values to be entered, things like that. We will work with you to overcome those issues. It is possible that a not eligible finding could be found in going through the numbers if the threshold's not met, for example. We'll end up with 2 state findings through the attestation validation. Eligible, which means you move on to the payment process, and not eligible, in which case notification will be sent indicating that you're found not eligible with additional documentation. The payment process, it begins after the eligibility finding, and DMA will have approved the attestation, and then we are required to check with CMS to get their approval to pay. They check to make sure there are no duplicate payments with other states, no actions that would preclude being payment. If CMS approves, then we send the payment request to the MMIS system. If CMS does not approve, then again, there's possibility of outreach or denial letter. MMIS makes a payment during the next check write cycle, and after the payment, we at NCMIPS are notified, and that will complete the payment process. So wrap up, I promised some links. I'll leave this page up for a short period of time. The starting point would be the DMA Electronic Health Record webpage. In there, there are links to CMS site, useful information in FAQ. We also have an attestation guide. There's a link here. And the NCID website that I mentioned previously is shown here. You can put these up during questions and answer if people want. But for now, move on to the contact information. This contact information is included, again, in the EH attestation guide. And if you have specific processing questions, the CSC NCMIPS operation group can address those. If there are general program or policy questions, DMA's NCMIPS group can answer those, include that contact information. And then Amelia with NCHA has volunteered to assist in questions if they wish to ask them anonymously or through the organization. This time, I'd like to open things up for questions. If you give us a second, we'll get set up for that and be right back with you. I'll go back to the links page.
Thank you, Bob and Jim. That was a very detailed presentation. I would like to remind everybody that we are available for questions. These questions will also be documented, and we're going to use to post to the website to help other hospitals that could not attend today. And just as an additional note, the payment process, the payments can be found on your remittance and status advice. It is considered a financial transaction, so you would see it as a total payment in your financial transaction section towards the back of or the end of the RA.
So far, we received several questions. One question has been asked, what if the cost report has been amended? If the cost report for the time period has been amended, we need to make sure that that cost report has been signed and certified and mailed into Medicaid. That information will be given to OMIS so that they have the latest and greatest data for use in matching the attestation. The second question that has come up is if there are participants who were unable to view the entire program or listen to it due to difficulties, will the screenshots and PowerPoint be available after the presentation? And my answer is yes, we will work with the association to have this posted in an available spot where participants can go back and revisit it at a later date. Another question which has come in is there a settlement on the cost report for actual days versus projected days used in the calculation? If I understand the question, the answer is this. We are using the as-filed cost report by the hospitals, which has been signed and certified to the Medicaid program. That is the data to which we are attesting and which should be entered into the program. It is not audited data that is 1 to 2 years after the fact. It is on as-filed cost report data submitted to the Medicaid program. Another question is, where can I get a copy of the payment calculation worksheet? We covered this in the presentation in 4 separate screens, but in fact it is a single Excel version of a spreadsheet, which the anticipation is we're going to transmit that to the providers with their payment or shortly thereafter their payment, so they may see how the payment was arrived. So we can certainly furnish the template to the association, but the expectation is that that payment calculation worksheet will accompany the payment. Another question is, could you please describe the relationship of OMIS, DHHS, and CMS?
Thank you, Jim. CMS, the Centers for Medicare and Medicaid Management, is the funding source for the federal funding for North Carolina Medicaid. DHHS is the Department of Health and Human Services. There's a federal level and a state level. At this North Carolina state level, Secretary Lanier Kanzler heads the Department of Health and Human Services for North Carolina. North Carolina Medicaid falls under the Division of Medical Assistance, which is a division within DHHS, North Carolina, and that is head by Director Dr. Craig Gray. OMIS, the Office of Medicaid Management Systems, is another division within DHHS and is led by Director Angie Sly. That office functions as a project office for DHHS and was originally created to head the replacement MMIS system and into a multi-payer claims adjudication system for Medicaid, mental health, and public health.
Another question has come up is, what is the average time between completion of the attestation process and receipt of the payment?
That question varies based on the accuracy of the information submitted. If the information submitted is complete and matches the information that Medicaid has in-house for you, then the payment process would take approximately 3 to 4 weeks. If we are contacting you and are asking that corrections be made to your attestation due to cost report information not matching or your patient volume not matching the information that we have on record, then that extends the time frame for payment processing to, depending on how fast the hospital responds, it can take anywhere from an additional 3 to 4 weeks.
There is an additional comment to what Lori had said earlier with regard to description of the payment on a provider's remittance advice. DMA has given to the association an example, a live example with redacted information of a payment showing on a remittance advice to show where the payment will be reflected in the RA and how HP has selected it should be coded. So if that is available, we can also post that so that providers can see and verify that in fact they have received a payment in their remittance advice. We have another question as to, a general question as to, when should providers begin attesting?
That is a personal question that each hospital has to answer for themselves. I would recommend that each hospital look at their numbers and look at how the calculation functions. We have been advised by CMS that once a provider attests and a payment is made, that payment cannot be taken back, because let's say the hospital discovers that if they waited a year that their patient volume had increased and their payment would have been higher. These payments are calculated for a single time if you have the full 4 years of cost report and average growth rate. However, we are working through a process, and some additional information will be published related to hospitals who have had a change of ownership or a merger. Anything that has changed your Medicaid provider number, in essence, is considered under a secondary process that we are researching with CMS and other states to ensure that we follow the process accurately. In those cases, there could potentially be adjustments made in subsequent years to your payment. However, once a provider has attested and the payment has been made, that payment is considered to be final. So I would recommend to hospitals that they look at their discharges and their growth rate to determine when is the best time for them to request a payment. CMS on their electronic health record website also has frequently asked questions regarding the payment calculations and how the payment process is, the electronic set of payments are completed for hospitals.
At this time, are there any other questions from the participants? It appears that we've covered all of the questions that have been asked to date. If there are other questions that arise subsequent to this, the contact information has been placed in the PowerPoint presentation, and we can follow up with that. With that, I'm going to hand it over to Amelia Bryant, who has a few parting comments.
Thanks everyone for joining us today. NCHA will publish both the repeat of this presentation on our website and the additional forms that you guys asked for during your question and answer session. If there are any other questions that come up after we conclude the presentation today, you may contact me in addition to the individuals listed on the website. However, if you choose to contact me, it'll take you a little longer to get an answer. I will in turn be using our team here today as our resource. Again, NCHA thanks you for participating today. And Lori, do you have any closing remarks?
Thank you, Amelia, and the North Carolina Hospital Association and all of the hospitals who have participated today. We hope that this has been helpful. We will also be working with the Hospital Association to do future webinars relating to Year 2 meaningful use attestation process and future releases of the NC MIPS system. And so you should look for those in the coming months, probably in the February-March timeframe. Thank you very much.